we'll have the firefighter, Dr. SAMINA, to counter that.
Which, this one? Okay. Okay, right. That's it? This one? Okay, this one, yeah. A very good morning to everybody, and I thank WAS to give me this opportunity to debate. Okay, very good.
Timer reset.
Can you reset the timer, please?
See, the adaptability of monovision is taking much longer than multifocal. SAMINA? Let's start, no? While they're putting it up.
Yeah, okay. So, you good?
It works, it works. Monovision works.
Yada yada hi dharmasya glanirnirbhavati Bharat. When I see Dr. Shilpa in front of me today, I feel that I am Arjuna. And there are hidden tears in my eyes because I have to fight with my dearest friend. But then when I see Suvira and Parul sitting over here, telling me, like Krishna, that go and seek the truth, I am going to take their advice. Friends, I could have continued this drama. You know, I'm a theater person, and I love to do this. And everybody knows that also. And it was expected also, you know, that I will do some drama. But then, now in this, when I am a truth seeker, I would fall back on science. I would just fall back on what we have already studied about the so-called multifocal lenses. The ASCRS guidelines for cataract surgery released in 2017. Can you guess what is the second commonest cause of IOL explantation? It's a no-brainer. Multifocal lenses. Will eye doctors choose multifocal for their eyes? Yes, Upma is vehemently telling no, no, and no. If I take a show of hands, which I don't want to do, we will, most of us will not choose a multifocal lenses. But then I want to prove my point. I thank Dr. RAMESH DORAOIRAJAN to share this slide with me. He has done a study of South India because we are in the South India. I thought, let me share this South India study. The Visionaries WhatsApp group, 17 people were asked, 7 people chose multifocal. Worldwide Telegram group, when people were asked, 10 responded and one favored multifocal. SN alumni, 1 out of 14. Shankar Nethralaya alumni. Keranet, 1 out of 7. So here you go. Why I prefer monovision, and when I say I prefer monovision, I'm very happy because I share this with Professor Barrett. And can you believe, surprise, surprise, this person sitting in Australia with all the fancy gadgets, with his own formula to back him up, in 66% of his patients, he prefers monovision. And so do I, Dr. SAMINA ZAMINDAR. To help us see our patients see better, happy patients are happy doctors. Avoid unnecessary chair time for patients with disturbing visual symptoms due to multifocal IOLs, and hence a stress-free life for doctor. Why I do not like multifocal lenses, and I promise that I'll talk science and no drama. Let's see this. A 25-year-old optometrist with 6'6", a 77-year-old with 6'6". Our macula will not remain like this. I see a few retina specialists sitting over here. I'm sure they will agree with me. How many of our patients will not get any of these 20 years later? So is monovision inferior to multifocal implants? This was a study on visual function and patient satisfaction, a non-industry supported study in 2010 which suggested that Pseudophakic monovision achieved distance and near vision that were comparable to those with bilateral multifocal IOLs without the inherent risk of disturbing visual symptoms associated with multifocal IOLs. Monovision patient had significantly better intermediate vision and less difficulty using computers without glasses. Randomized trial of multifocal intraocular lenses versus monovision after bilateral cataract surgery. This again goes to show that total spectacle independence 26 versus 71, explantation rate was 5%. And uncorrected near vision was better in multifocal, uncorrected intermediate was better in monovision. Randomized trial of multifocal intraocular lenses versus monovision after bilateral cataract surgery, a huge study, which again showed that there was the IOL exchange rate was very high in the multifocal group. In this study, it clearly showed that, just on 30 seconds more, this study clearly showed that dysphotopsias were more in multifocal group. So is multifocal technology foolproof? Let me again go to Survey of Ophthalmology, an article, a very well-read article published in 2017, which showed that none of the multifocal lenses are physiological in nature, because multifocality is not physiological in nature, and too many variables like age, lifestyle, psychological profile, pupil size, comorbidities, surgeon's attitude, education, and experience. This I am not telling, this Survey of Ophthalmology 2017 is telling us. And how many of us actually check for angle alpha? There are too many things left to chance. Are we here hard selling a technology which is even not foolproof? Would you like to be the guinea pig? Profit per eye 15,000 versus 40,000. I have to ask myself, am I implanting because it is better for the patient, or I want to earn more money? Friends, I rest my case with these words. I can only be as good as my team.